Okay. Hello guys. So today we'll cover respiratory physio and the miscellaneous topics. Okay. Let's start the quiz. So the first question is, which of the following causes a rightward shift in the oxygen dissociation curve? Oxygen hemoglobin dissociation curve. Just a minute. So the right answer is increased temperature. Okay. Okay. Moving on to the second question. A 35-year-old tall, thin male presents to ER with sudden onset, sharp chest pain and shortness of breath. There's no prior medical history. On examination, breath sounds are absent on the right side. ABG shows PaO2 as 60, PaCO2 as 32. What is the most likely reason? So let's see. Right, it is due to ventilation perfusion mismatch. Okay. Moving on to the third question. 50-year-old man with a history of head trauma is admitted unconscious. His respiratory rate is irregular and appears to have a gasping pattern. A lesion is which of the following area is most likely responsible for this abnormal breathing? So they're asking the respiratory center. Okay, seven of you have chosen heart accident. That's the points. Okay, 22-year-old woman presents with recurrent episodes of wheezing, shortness of breath, chest tightness at night. Her sputum shows a wall mucus plug containing the epithelial cells arranged in spiral pattern as shown in the image. So what is this? What is the name of this finding? Okay, this is easy. That is Crushman spiral rate. Okay, moving on to the fifth question. 55-year-old male with history of chronic smoking presents with gradually progressive proximal muscle weakness. Reflexes are initially diminished but improve after a brief muscle contraction. There is no ptosis or diplopia. Which of the following best explains the underlying defect? So the reflex that improves with use sounds like it is reverse of myasthenia. So what is the mechanism seen here? Right, the correct answer is antibody against the presynaptic voltage gated conductance. That is nothing but Lambert-Eaton syndrome. Okay, we often can get confused between myasthenia gravis and Lambert-Eaton syndrome. I think these three diseases, that is myasthenia, Lambert-Eaton, and Guillain-Barré disease, these three are very important. In terms of that, you need to know the differentials correctly. Okay, at the end of five questions, we have Aisha leading the quiz. and Myra is in the second place, and S is in the third place. And we also have Krishna, Sank, Shalini, Naga, RTT, Bhagya, Sharanya, Dr. Reechtak, PKSM, and Ram Chennai. Okay, here's your sixth one. A patient with botulism presents with muscle paralysis. So, what is the mechanism? Easy one. To presynaptic terminal is sabotage. Right, is due to decrease in ACH2. I think the difference in the type of paralysis is also important in this type of question. Okay, here's your seventh one. A 25-year-old marathon runner reports excellent endurance but struggles with explosive movements like sprinting or weightlifting. So, which muscle fiber is predominantly developed in his legs? So, to give a clue, long distance runners love the mitochondria. Let's see how many of you get it. Right, it is type 1. Okay, type 1 muscle fiber. Okay, a 60-year-old diabetic patient has absent ankle jerk reflex. So, which of the following components is most likely affected? So, when the wires cut, the current won't flow, right? So, where is the most likely site of path of? Right, it is due to lower motor neuron. Okay, going to the ninth question. A 5-year-old boy presents with pallor and fatigue. Peripheral smear shows microcytic hypochromic ABC with target cell. So there's a positive family history of anemia there. What is the most likely diagnosis? So the best clue is target cell, hypochromic, and microcytic. So this will narrow down. You can narrow down it to one option here easily. Right, it is thalassemia. Okay. Here's your last question. A 10-year-old boy presents with recurrent joint bleeds and prolonged PTT. Platelet count and bleeding time are normal. So which factor is most likely deficient here? So this is a classic X-linked disease which is known to cause spontaneous hemarthrosis. Right, it is due to factor 8. So let's see the winner of the quiz today. And we have Myra again as the winner of the quiz. So congratulations, Myra. Then we have Aisha as the second winner and Dr. Reed Stark as a third winner. So congratulations, guys. And we also have Sharanya, Shalini, PKSM, Krishna, RDT, Bhagya, S, Tank, Naga, and Ramchandran. So congrats to you guys as well. So we are finally done with physiology. Tomorrow we'll have grand finale. So hope to see you in the next session as well. So keep revising and until then, good night.